Today we're going to talk about some stuff that I need to pack for the hospital and surgery, rehab, all that good stuff. As y'all know, I'm going to be having scoliosis full fusion surgery. It's a 2-day process, so next Wednesday and Thursday. I've been disabled for about 8 years now, so fingers crossed this surgery will help me. Anyway, I've been reading online some things I should bring, some things not to bother bringing. I'm probably still bringing too much, but I wanted to try to be as comfortable as possible. I'll be in the hospital for a week, and then I'll go to rehab for 1 or 2 weeks, depending on how I'm doing. Because we live like 5 or 6 hours away, I do have to stay in the Dallas-Fort Worth area for at least a month after surgery. So it's going to be a long time. Anyway, some stuff I'm bringing. First of all, I am on 2 prescriptions that are not pain related. So I'm going to be sure I bring those, and I have enough for a couple months just in case. The night before and the morning of surgery, if you've ever had surgery, I'm sure you already know this, you have to bathe with your, what is it called? You know, that alcohol kind of soap or whatever. So that's what that is. I've got some ibuprofens. I've got 1 night of my normal medications in here with vitamins and everything for the night before surgery, because obviously I can't take anything the day of. I'm used to taking melatonin every night. I don't know if they'll let me have it in the hospital or not, but I will probably need it afterwards. And I'm just bringing a small container of Tums in case I get upset to my stomach. Last thing I want to do is be upset to my stomach when my whole back is going to be hurting. On top of that, I've brought a couple little containers of shampoo and conditioner. Well, just one. I won't be able to shower for at least a week or 2, but for when I can, I'm going to definitely want to wash my hair. And then I was told to bring lotion. So I have like 4 little sample lotions from other hotel stays. I just threw in my little travel bag. I'm just bringing some fingernail clippers. I'm bringing my face clean stuff and extra moisturizer because the hospital is very dry. And this is just it's called Point Relief. It's stuff I can put on my back when it hurts. I can't take any pain medicine starting yesterday until I go to surgery. So I've been in a lot of pain, and this stuff has definitely been helping. They don't want me to take any oral medication so that he can control the pain better in the hospital. So I'm suffering quite a bit right now. We'll see how much of this I can get done in 1 day, but I'll probably have to break this up in a couple of videos. Anyway, Q-tips, just some cotton rounds for cleaning my face, and of course, deodorant. I'm sure I'll be pretty stinky by the time I can shower. Toothbrush, toothpaste, a razor, brush. I'm bringing these little wipes. They're supposed to be flushable wipes. We don't flush them. But anyway, I'm bringing these for the bathroom, but also a little sponge bath when I can't shower, because I feel really gross if I don't shower at least every other day when I'm in a lot of pain. Sometimes I'll stretch it out to 3, but I feel really nasty by then. So my daughter gave me this super cool travel pillow. It's got this little slide here so you can like slide it into your luggage, but it's cool because it's a pillow. Oh, and it clips on if you want to. But you can open up the little pillowcase. It's a super plushy blanket because I get so cold all the time. So I'm bringing this just to have something in the car and just an extra little throw blanket for in the hospital in case it's cold. And speaking of pillows, the hospital pillows, of course, suck. So I am going to bring my own bed pillow, which is a biggie, and I'm going to bring a body pillow. My husband's probably going to shoot me for bringing these, but I'm going to be in a lot of pain. So I want everything I can possibly have. This little bag just has underwear and a bra. I've got 3 pairs of the slip-resistant socks. I've had so many hospital procedures. I could probably have a drawer full of these if I kept them all. But anyway, I've got those. I don't usually wear these type of slippers because I find I can't really walk in them very well. But I know I won't be able to bend over to put my normal slippers on. So I borrowed these from my daughter. I didn't want to go buy a pair. I'm going to bring a couple of little plain little nightgowns. And I went and bought me a summer robe that is huge, that just ties so my butt won't be hanging out when they make me walk around the hospital. And that way I can just keep wearing their gowns and not dirty my own until I get to leave the hospital. I'm thinking I'm only going to bring one extra change of clothes because honestly, I'll probably be in my nightgown and robe most of the time. But the clothes I am bringing is a button-up shirt, really big, so I can get in it easily, and stretchy pants. I'll probably wear something very similar to Dallas, so that'll give me 2 changes of clothes. Don't really think I'll need more than that. These are a couple of things that I bought. This, which is really cool, it comes like that, just snaps into place. It's a grabber, so when I drop something, I can pick it up. I think that will be very handy because after surgery, they tell you BLT, no bending, lifting, or twisting. So BLT is the easiest way to remember that. Nice thing about this little guy is it just pulls apart, so it's a lot smaller and will actually fit in my suitcase. Now this might be a little gross thing to tell y'all about, but I bought this specifically for surgery. As I mentioned before, I had 2 discs fused back in 2016. When I had those 2 done, I had a lot of trouble even going to the bathroom by myself. So knowing that my whole back now will be fused, let's face it, folks, I'm not going to be able to wipe my own butt. Let's just be blunt. So I do not like asking people to do stuff for me. So I got this little thing from Amazon. Basically, you just kind of wrap toilet paper around, you stuff it in there, and then I can take care of my own business. And I don't have to get somebody else to do those pretty personal things. Totally washable, all that good stuff. Comes with his little inconspicuous bag, so nobody will know what it is until I'm proficient enough to go into the bathroom by myself, and then I can put it in there. This bag has all my chargers, cords, headphones, because I'm a super light sleeper, so I sleep with headphones every night. I've got 3 pairs of them just in case. Extra charger, my microphone in case I feel up to talking much. I brought an extension cord in case the plug-in to charge said devices are very far. I'll be able to reach. I haven't read a book in I don't know how many years, but my daughter gave me one for my birthday, and then this is one that she read that she says I should read. So I'm going to start. I know I'll be very bored in the hospital and in rehab sitting there all day long, so I'm going to bring a couple books to read. And I have my iPad, so I can watch Hulu, Peacock, Netflix, whatever, and not be too bored. And this little handy dandy thing I bought actually is more for flying, but it's really cool because you can put it like this. Okay, and it makes a little stand, and then you can put it's more for a phone, but since I'm filming with my phone, put your iPad or whatever in it. But it's more for a phone. It'll hold your phone up so you can use your phone and not have to sit there and hold it. So you just arrange it however you need it. It can also be designed to like hang over the tray table from the seat in front of you, etc. What's really cool about it is it folds so flat, so it takes up no space. And then bring a notebook in case I need to write anything down. I have a super short memory. I call it my 5-minute memory. So I have tons of reminders in my phones for everything because I can't remember anything. So in case the doctor or nurse or somebody tells me something I need to do, I'm going to write it down because I won't remember. Beyond that, I think that's pretty much all I'm bringing. I'll probably end up with a few other things before I actually leave, but this will be the gist of it. I want to show y'all a couple other things that I have in my home that helps me here at the house. One thing is my bed. So I have an adjustable bed. So when we bought these, it's a Sleep Number bed. When we bought it, the adjustable part at Sleep Number was extremely expensive. So we bought 2 hospital beds and put them next to each other. So we have our own sides adjust. This is obviously my side, the head, and I can also raise up the foot part. So I can use as much comfort as possible when I try to sleep. You can also see I have a couple of throw blankets on here. When I'm sleeping at night, because I have such poor circulation, my toes go numb. So they feel like they're cold all the time. So there's times I have to get up, put on my house shoes. I don't want to put my dirty house shoes I wear all over the house in my bed. So I use this little throw blanket over me. And then I have this little throw blanket for my arms, etc. when I'm doing that. So when I'm not fully in bed, I can use that. So now I'm going to just see if I can get all this in there. Here we go. I've already got my grabber stick in here. House shoes right in there, and voila, everything but the pillows and the blanket, which is fine because I'll probably leave those in the car and have my husband bring all this stuff in once I'm in my room.